At Genomics England, we're working hard to bring the benefits of genomic medicine to everyone. We do that by turning science into healthcare using technology. And as you can imagine, that field is changing all the time, and we need to innovate to keep up with it. At our event on the 29th of September, we're going to be exploring 5 areas of innovation. First, how genomics is transforming our understanding of Covid-19. Second, how in partnership with the NHS, we're rolling out whole genome sequencing where it's relevant for patients across the whole of the NHS today. Third, we're exploring the potential for newborn sequencing to transform the diagnosis and treatment of early onset conditions. Fourth, we're looking at how new sequencing and other technologies are transforming our understanding of cancer. And finally, we're showcasing our work in addressing health inequalities and making sure that the coming genomic medicine revolution is accessible to everyone. In early 2020, as the Covid-19 pandemic was gripping the world, we at Genomics England decided that we had to bring all of our capabilities, assets and expertise to bear on solving the mysteries that this novel disease presented. In this session, our Chief Medical Officer, Dr. Richard Scott, will talk to 2 of the leading lights who ensured that the UK was absolutely leading the world in using genomics to understand and fight back against this terrible disease. We'll be talking with Dr. Kenny Bailey from the University of Edinburgh, who led the human genome sequencing efforts to understand this disease and how it affects our bodies, and Professor Sharon Peacock, who led the viral sequencing efforts around identifying and managing the different variants that emerged. At Genomics England, our mission is about bringing the benefits of genomic healthcare to everyone. And the rubber really hits the road for that in a healthcare setting. At Genomics England, we're incredibly proud to be partnering with the NHS to bring whole genome sequence-based insights into the diagnosis and treatment of any patient in the NHS for whom that's relevant. I'll be joined at our event on the 29th of September by Professor Dame Sue Hill, the Chief Scientific Officer for England and Chief Scientist of the NHS, and Dr. Ellen Thomas, who's our Clinical Director here at Genomics England, to talk about how we're developing and scaling that service and the impact it's having for patients. One of the most strategic initiatives that we're working on at Genomics England is exploring the potential of whole genome sequencing to transform our understanding of the diagnosis and treatment of the sickest children when they're first born. This raises all sorts of questions, and so we're working with the NHS to explore what this could look like as a service at national scale. We're listening to and talking with a whole range of communities and stakeholders to understand the ethics and the issues associated with doing this in the real world. We'll be touching on both of those topics in this session, where Dr. Richard Scott, our Chief Medical Officer, will talk to Sarah Jane Marsh, the Chief Executive of Birmingham Women's and Children's Hospital, and Simon Wilde, our Engagement Director, will talk with Rebecca Middleton, who's one of the members of our participant panel. In our cancer session, our Chief Partnerships Officer, Parker Moss, will be talking with Professor Serena Nick Zainal and others about how these emerging technologies can have a huge impact in a patient context, where we can get to faster and earlier diagnoses, and in a research context, where we can link imaging data, genomic data, and clinical data to get to all sorts of new insights that will help us in our fight against this terrible disease. In our session on genomic data diversity, we're going to be exploring a historic challenge that the genomics community has faced, and our work to address the health inequality challenges that arise from that and make sure that the genomic medicine revolution is accessible to everyone. We've had great engagement with this programme, working with communities up and down the country and with healthcare professionals to make sure that we can bring these insights to everyone in Britain. Indeed, addressing health inequalities is such a priority for the Secretary of State, Sajid Javid, that he has himself volunteered to be a participant in the programme. The session will be chaired by Dr. Maxine McIntosh, our programme lead for Diverse Data, who'll be joined by Dr. Harpreet Sood and Sufyan Dogra from the Born in Bradford programme. We really hope you enjoy these 5 sessions. The world of genomics is changing incredibly fast, and we're glad that you're coming on the journey with us.